Friday, everyone. In just a few days, daylight saving time will end. So that means there will be more light in the morning and it will get dark earlier in the evening. And while people are looking forward to an extra hour of sleep this weekend, I know we are, turning the clock back 1 hour on Sunday can have an impact on your health. So this morning we are joined by Dr. Cottingham with Lexington Family Practice Forest Acres for tips on how to make the transition as smooth as possible. Thank you so much for stopping by, because everyone's going to have to deal with it this weekend.
Thanks for having me.
Yeah, let's go ahead and talk a little bit about, in general, how does daylight saving really affect the health?
This time of year is not quite as bad as the fall, but it's still going to affect us. So anytime you affect your circadian rhythm, you know, you're going to be thrown off a little bit. So we're going to bed an hour later. People are still going to wake up a little bit earlier that first week. So we get a little more car accidents, unfortunately, a little bit of increase in depression. Those are the big things.
Wow, okay. But it's not as bad as what we have, because now we get to sleep a little bit more
extra,
in, right?
Yeah,
okay.
Exactly.
So what are some tips that you kind of are going to give our audience a little bit when it comes to this weekend?
So you want to probably go ahead, you know, maybe tomorrow night, start pushing your bedtime a little later, 15, 20 minutes later each night.
Okay.
And that'll help a lot, hopefully, for Sunday when you do wake up.
Now, is it important to kind of start doing this now and not wait last minute? How important is it, or is there maybe a specific amount of days that we should wait?
About 3 or 4 days beforehand, if you can start bumping it back about 15 or 20 minutes, that way you're ready. You could wait till Saturday night, but it's probably even better if you can start ahead of time.
What
especially
about
for kids?
I was going to say, so what are your advice for maybe kids or older adults in having to transition with this?
Yeah, I would say definitely start earlier, just so your body gets used to it. A lot of times too, if you push your meals times back a little bit, same thing, 15 or 20 minutes each night, so you're kind of getting your whole routine ready.
I'll tell you who's really confused: pets.
Yes, they are.
They're very confused with all of this. What about any type of medication that you kind of recommend with this?
Melatonin, if it's, you check with your doctor always, but melatonin and low doses can help you fall asleep. They're not going to help you stay asleep, but can help you fall asleep, and you'll take it about an hour before bedtime.
Okay, that's not bad there too. So what about kind of just the general consensus of kind of sleeping, and how important is it to make sure that you get, you know, they always say 8 hours of sleep. Is that what you say?
Sleep is super important, obviously. 7 to 8 hours for adults and a little more for kids. And then, you know, just if you're not sleeping well, it affects everything with your health, your mental health, your cardiac health, everything. So you want to make sure you're trying to get that good 8 hours of sleep.
I was going to say, so sleep is not just, you know, you're going to have like a well-rested night and you're going to have a good day. It affects literally from head to toe.
It does.
Wow, that's interesting. Well, Dr. Cottingham, thank you so much for stopping by this morning.
Thanks for having me.
I am going to enjoy this extra hour of sleep this weekend.
Excited.
There you go. You see, I think we're all just excited for that extra hour of sleep. All right, don't go anywhere. We have more of your top local stories when we come back. Stay with us.